the more that we see dog worship, the more that we see human sacrifice. So let's look at this thing in USA about poor access to health insurance or healthcare. So let's start off with this little summary. The United States ranks last in healthcare access among high-income countries, primarily due to out-of-pocket costs and a significant number of uninsured individuals, and this contributes to poor health outcomes. So this is a big topic in the political world and everything else. Is we got to have health care. We got to have health care like the other countries. We got to have free health care, and we got to do something, But one of the things that they talk about is we got to be like other countries. Well, other countries don't worship dogs like we do. So how about that? That's something for you to think about. Let's go to our next little research summary. So, while we can't afford to take care of ourselves, look at what we're spending on dogs at vet clinics and other expenses. $39 billion. $39 billion for pet care. So we got all this money to spend on our pets, but we can't get insurance. We can't afford health care. We can't afford a book on human nutrition. But this is the kind of money we can spend on our dogs. So dog culture needs to be a part of this discussion. With the worship that we do with dogs, there's no way that we're going to have the proper excess money and excess time to take care of ourselves. So just dog bite injuries, for example. I'm not even talking about diabetes, obesity, any of the other things that dogs contribute to. Yes, dogs contribute to heart disease, for example, because of all the stress they cause. Go ahead and look at the incidence of heart disease in Japan or Iceland or other low dog ownership countries. But let's read our summary here. The U.S. spends significant resources on dog bite-related injuries. 1,000 people requiring emergency care daily, about 12,480 hospitalized annually due to serious dog bite injuries. So this is a serious healthcare cost. So if you want to reduce your healthcare cost, reduce the amount of dogs that your community owns. I mean, the numbers don't lie, people. Facial surgeries on little kids, broken bones, ripped out tendons, all types of problems, just from dog bites. So, you want to start talking about healthcare, dog culture needs to be part of this. If you look at some of the surgery claims that get paid, look at this. $69,000, see this blue highlight? So insurance companies are paying out, easily millions, if not hundreds of thousands. If you start looking at some of these articles like this one right here, or looking at some of the stories that actually show up in the news, insurance companies are paying out billions and billions of dollars just for dog bite injuries. So of course they're going to raise their rates. Of course they're going to find exclusions and not cover you or not cover your children, because they're already getting thrown under the bus with your damn dog bite injuries. So of course they're going to reduce what they're going to offer you, because they have to protect their bottom line. And their bottom line, an insurance company, just read any of these articles, guys. You look at the payouts in these injuries. Look at the numbers. What do we got here? $58,500 settlement. This one right here. You look at the amount of money that medical insurance companies are paying out for these dog bites. 1,000 people in the emergency room per day. Of course, they're going to reduce what they're going to offer humans. I mean, because they themselves that work in the insurance company probably don't even care about humans. Or let's go to our next little thing. Like I was saying, guys, many dog owners prioritize their pet's health of their own. So if you're working in an insurance company and writing all the bylaws and writing the policies, and you're one of these people that care more about dogs than humans, and you're watching all this money from your insurance company go to dog bite claims, of course you're going to write the policies to favor dogs. But yeah, 90% of dog owners consider their dog's health as important, more important than their own. A significant number of pet owners have made lifestyle changes to accommodate their dog's needs. So dog owners will sacrifice their own health to give stuff to their dog. So that's cascading down to everybody. So let's look at some other numbers. So as of 2024, there's approximately 130,415 veterinarians practicing in the United States. So, well, there must be then like at least that many pediatricians, right? No. According to what I looked up, 29,600. So think about that. They say that dogs are our children, right? But yet they have way more pediatricians, or I'm sorry, way more veterinarians than pediatricians. So you're going to start talking about healthcare. You're going to have to look at dog culture. We live in a dog worshiping society. People care more about dogs. Insurance companies have to pay out for dog bite injuries. So, of course, what we can get for healthcare is going to be reduced so that it can be given to dogs. One of the groups of people that suffers the worst is children. Children suffer from lack of healthcare. I mean, that makes sense. If you don't start out with a good habits and a good doctor and a good diet, your healthier is going to suck as an adult, because for one, you're not going to even understand what the cost of being unhealthy is. So just think about it. If some of those people that are spending billions and billions of dollars on payouts for dogs and all that other stuff, if they could put like a third of that into these millions of kids in the U.S. that have inadequate healthcare coverage, think about how much healthier all those people would be. And let's look at another group that also suffers from this. It's the uninsured and marginalized groups. So any politician out there that says they're supporting this group or that group or this skin color or this sexual orientation or whatever, well, those groups are the ones that are also sometimes with the lower income or uninsured or marginalized. So if you want to offer health care to whatever group that you think needs more health care, well, you need to be talking about minimalizing dog worship then too. Like the rainbows, the LGBTQs, the BIPOCs, the indigenous, all the politicians say that they're here to help all those people. Yet those people are the ones that are going to be tricked into dog ownership more. Those are the people that are going to be part of dog culture more, because they're just marginalized, or they don't understand all the other things that go along with owning a dog, all the stuff that they have to give up. So speaking of insurance, let's look at dog insurance. Americans spend about $3.2 billion annually on pet insurance premiums. $3.2 billion annually just for dogs. And did you know that a large portion of those policies are denied when something happens with the dog? I have another longer video that covers all of that with some really good peer-reviewed sources for you guys to look at. But think about that. All this money going into pet insurance, but then we can't afford insurance for ourselves, our kids. We can't afford mountain bikes, hiking shoes, good food, good medical care, good dental care, and all that stuff. But we're pretty much throwing a good portion of that $3.2 billion annually on mangy, stupid, ungrateful dogs, when we could be putting that money into some decent humans that will grow up to be a lot healthier because of our effort into them instead of these ridiculous dogs. So there you go. That's a look at healthcare as it relates to dog ownership. And America has the highest rate of dog ownership in the globe, and America has the highest rate of people that are having all sorts of different health problems: stress, heart disease, obesity, childhood cancers on the rise. So dogs have to be a part of this conversation no matter what. See you guys later.